Hello, Women's Alzheimer's Movement Instagram followers. Hopefully you're hearing me live now. My name is Josh Grill. I'm a faculty member in psychiatry and human behavior, as well as in the Department of Neurobiology and Behavior at the University of California at Irvine. And I'm also the director of something called the Institute for Memory Impairments and Neurological Disorders, or UCI Mind, which is home to our Alzheimer's Disease Research Center here at UCI. I'm really honored to have the opportunity to speak with you today on behalf of the Women's Alzheimer's Movement. I'm a scientific advisor to WHAM, and specifically, I've been asked to talk to you today a little bit about clinical trials, which is my area of expertise and area of academic interest. And I'm a member of the very large NIH-funded network of clinical trials for Alzheimer's disease, what's called ACTC. So thrilled to be with you today, and always happy to work with WHAM, and always happy to have a chance to talk about clinical trials. So I've already got some questions that were sent in advance of our session today, and I'm gonna dive right into those, and also try to keep an eye on the stream so that I'm answering any questions you might have today. So to begin, seems like a good place to start. What is a clinical trial? A clinical trial, to be very frank, is an experiment or a research study in which human beings are the population being studied, and an intervention is being tested, something typically that we hope will make people better medically. It might be something to try to improve the symptoms of Alzheimer's disease in people who have dementia. We've put a lot of energy into studying agents that we hope can slow the course of Alzheimer's disease. Now we're testing drugs and other interventions in hopes of finding things that can delay or even prevent entirely the onset of memory problems in people who are at risk for Alzheimer's disease. So clinical trials really represent the gold standard type of rigorous research study to produce an evidence that will instruct clinical care for people with any disease, but we're talking about Alzheimer's disease. And importantly, clinical trials really represent the only pathway to new FDA-approved drugs and changing the way we practice medicine in the world today. We get asked a lot about the different types of trials for Alzheimer's disease, and I've just kind of alluded to several in my opening remarks. And we are eagerly testing compounds that we hope can help patients who are already dealing with dementia do better, perform better on memory tests, perform better in their daily lives, maintain their independence. We have some drugs that have achieved that milestone and have been FDA approved, and we have drugs that are used now to treat people with Alzheimer's disease. But we still don't have any drugs that have been FDA approved for being able to slow the course of Alzheimer's disease. And that's an area extremely important research and a lot of ongoing activity. And if we had drugs that could slow the course of Alzheimer's disease, it would be extremely important to then start those therapies as soon as possible, even before Alzheimer's disease begins. And so there's a lot of activity now, and I'm thrilled to be a part of some major clinical trials that really aim to see if drugs or other interventions can actually prevent people from ever getting memory problems. So moving to some of the questions we got in advance, are there clinical trials that test things other than drug versus placebo, like lifestyle changes? And absolutely, the answer is yes. And this is an area of major investment for testing lifestyle modifications, controlling blood pressure, for example, exercise, dietary interventions. There are there are numerous clinical trials that are aiming to increase our understanding and evidence base around whether these types of behavior changes or interventions can actually slow the course of Alzheimer's disease or prevent someone from getting it. And I would point our audience to one major initiative here in North America called the U.S. Pointer Study. This is being sponsored by the Alzheimer's Association, being led by my friends and colleagues at Wake Forest University and Dr. Laura Baker. And if you're interested in learning more about the Pointer Study, you can visit the website for that study. And I brought it up so that I could make sure I got it right. It's alz.org/US-pointer. Also, you could Google U.S. Pointer and Alzheimer's Association. That's a very exciting study of a multifactorial approach to trying to delay or prevent Alzheimer's disease with exercise, diet, cognitive training, and the like. Most of my work has been really around drug studies. And in ACTC, we are about to embark upon one of the most important and most aggressive efforts to try to prevent Alzheimer's disease with a drug intervention. And that study is going to be called the AHEAD 3-4-5 study, where we will test an amyloid-lowering drug, amyloid being the protein that accumulates in the brain of someone with Alzheimer's disease, to see if we can stave off the onset of memory problems that are caused by this disease. In AHEAD 3-4-5, we're very specifically targeting a population of people who are at increased risk for Alzheimer's disease because amyloid seems to be accumulating in their brain. And so in trials like AHEAD 3-4-5, people also have to have a PET scan to see if their risk of getting Alzheimer's disease might be increased because they have slightly higher levels of amyloid than we might expect for someone their age. And only those individuals can then be enrolled and randomized to receive an amyloid-lowering drug or placebo. In all of these situations, we're talking about major commitments, long trials, multiple years, 3, 4, 5 years, depending on the study. And another question we get is why would someone do that? Why would someone want to be in one of these trials? And the people who participate in these trials are very much my heroes, and we can't find a cure or prevention for Alzheimer's disease without them. And I've worked with a lot of people who've participated in clinical trials over the years, and I can say that most people enroll in trials for one of 3 reasons. One, they're remarkably altruistic. They really want to be a part of the solution. They want to help us find a cure and prevent the next generation from dealing with this disease. 2, they trust the people who are doing the studies that that's what's going to happen by them participating, that we're going to move forward scientifically and we're going to find answers. And 3, they hope to benefit, and no one blames them for that desire. Many people participate in prevention trials because they want to be first in line when we find something that can actually stave off Alzheimer's disease. Many people enroll in disease-modifying trials because they want to slow the course of the disease in themselves or in their loved ones. And so usually it's a combination of factors, including each of those 3 things. They're altruistic in spirit, they trust the people who are doing the trial, and they hope to benefit. Now, as I'm reading here, I'm seeing a couple questions I'll try to answer. One was, how has COVID affected trials? So each of the trials I mentioned, the U.S. Pointer as well as the AHEAD 3-4-5 study, and I wanted to be sure to give you the AHEAD 3-4-5 study website as well. That's a3a45.org. Each of these trials has been delayed by COVID-19 and the global pandemic caused by the SARS-CoV-2 virus, as has really all research in this and every other country around the world. We've worked really hard as an institution and as a field to try to be extremely safe in our approach to how we do science, and in many cases that's meant putting studies on hold while we reasserted our safety practices in the medical center for doing these studies. Many of our clinical trials have continued throughout the global pandemic, and now we're starting to see other studies really begin to ramp up again. So we've without question been delayed by COVID, but we are pushing ahead now in a very careful way. And research is always voluntary. People are never obligated to come in and be in a study, and if they have great concerns around COVID, we do everything we can to alleviate those concerns, but folks who aren't ready simply are staying home until they are ready. A couple other questions came up. What about young people? Do we have trials for young people? We do. The AHEAD 345 study will enroll people as young as 55 if they have a family history of Alzheimer's disease or are known to carry other specific risk factors. And I think that we're going to see more and more studies going younger and younger in our efforts to try to prevent the disease. How do I know if I'm eligible for clinical trials? It's very true that clinical trials have extremely strict criteria of who may participate and who may not. This is important for a number of reasons. One, safety is paramount in clinical trials, and we would never put someone into a clinical trial at their own peril. There are always some risks in a clinical trial, but we design them with an eye toward making sure that we can protect people's safety to the greatest extent possible. The other critical point about inclusion and exclusion criteria is that we need to make sure we're going to answer a scientific question. And that usually means controlling the population that we're studying so that we know how to interpret the results of our study. The unfortunate byproduct of this is that for many clinical trials, and we've published some papers on this, as have other colleagues, in Alzheimer's disease dementia clinical trials, most patients actually don't meet the standard criteria, and we have to turn away more than half of potentially interested eligible participants, which is a heartbreaking thing. It's the hardest part of my job to tell someone who wants to be in a clinical trial that they can't be. In the prevention space, it's a different animal, and those brain scans and other biomarkers of the disease are one of the bigger drivers of lower eligibility, which could be a good thing for people who are in their 6th or 7th decade of life and interested in helping, but don't have a high enough risk to be in our prevention trials, for example. How can you know? The clearest way to know is to screen for a trial. Reach out to your local site. I know our audience is national, if not international today, so look for a site that's doing clinical trials in your neighborhood. And the National Institute on Aging website is a great place to look for academic centers like ours here and see where the nearest one to you might be. Reach out to them and say you're interested in being in a clinical trial. In the AHEAD 345 study, we're working to have an online system that people can fill out and try to get a better sense of whether they might be eligible and right for that study. And we're also extremely motivated to make sure that if the study we're not doing isn't right for a person, that we try to point them in a direction that is right for them. Because sadly, one of the most consistent barriers to moving the field forward and finding better therapies or preventions for people is that essentially every clinical trial, and this is true for Alzheimer's disease as well as just about every other area of medicine, one of the greatest challenges is getting enough people into the study to be able to answer the scientific question at hand or test the therapy. Oftentimes, if a trial is 18 months in length, meaning that when someone enrolls, we're going to keep them on the treatment we're testing for 18 months before we decide if we think it's helping them. It could take 3 years to find the full total number of people we need for that study. So if a study is an 18-month clinical trial, it can take 5 years or longer to complete it. And we've been working really hard to try to find ways to accelerate that part, to get more people into clinical trials. One of them is to simply do a better job of getting the word out by doing things like this, what I'm doing right now with you, and making hopefully the world know and understand the importance of clinical trials. But we've also been developing new tools, and one that I'm particularly excited about is called a recruitment registry. Registries are repositories of people who've said, I'm open to hearing about clinical trials or other studies if they come along. They're completely voluntary. There's no obligation, but you're putting yourself in line to hear about studies if the right study comes along for you. Now, here at UC Irvine, we've developed our own local registry where we've enrolled more than 4,000 people in Orange County, Southern California. But there are national registries as well that people can join if they're interested in being in line for those clinical trials when they come along with absolutely no obligation. And one of those is specifically built to point people toward studies like AHEAD 345, the next wave of aggressive Alzheimer's prevention clinical trials. And that registry is called the APT Web Study, aptwebstudy.org. And that's a registry that people can go online, give some information about themselves, and then have their memory tested periodically. And this information, in combination with demographic factors like age and family history, is used to identify people who might be ideal candidates for the next generation of prevention trials. Another question that just popped up is one that's near and dear to my heart, which is how do we get diverse people to be in clinical trials? And again, another extremely consistent challenge we face in clinical trials is that too often the people who are enrolling are very homogenous. They are well educated, they are affluent, and they are non-Hispanic white people. And this is incredibly problematic for a number of reasons. One, if we test a drug in well-educated white people and it looks like it works, it might get approved. And whether that drug works the same in everyone would be essentially unknown to us. And there is some precedent that drugs may not work the same in all different people of different cultures, genetic backgrounds, races, and ethnicities. And so clinical trials really represent the best opportunity for us to get true evidence around whether a drug is equally safe in everyone we hope to treat with it. And we are very focused on finding treatments that help everyone with Alzheimer's disease. It is a disease that knows no racial or ethnic bounds. Every community is affected, and some communities, like African Americans and Latinos, seem to be disproportionately affected. And there too, we have an added rationale for needing to improve the diversity of people participating in clinical trials, because in addition to safety, we would never want to miss a drug that works in some populations but doesn't work in others. And again, there is precedent for differential efficacy in different populations. And so if we had a drug that could work in African Americans or Latinos or Asian Americans, but we didn't have any of those people in our clinical trials, we might miss it and if you will, throw away that drug that could have helped a whole segment of our population. So many of us are putting tremendous effort into trying to increase the diversity of our clinical trials, working closely with those communities and our local sites, but also putting effort into trying to diversify the pipelines, that is those recruitment registries like APT Web Study and local registries, trying to get more diverse people into those registries so that they might be in line for participating in studies when they come along. And we're always looking for people who want to join us in this effort, be champions, use social media and other platforms to try to help diversify all of our studies. And I'm a part of a registry here in California that's actually aiming to recruit Asian and Pacific Islanders, and it's called the Care Registry. again, with the exclusive goal of increasing Asian and Pacific Islander representation in all research of people who are older, who may have Alzheimer's disease, caregiver research, and the like. So there's a lot of movement afoot to try to get better at this, because we know it's critically important that we do. So a question still in my field of view: are people compensated for participating in clinical trials? The answer is yes, but it depends on the study whether there is compensation and how much. I am a firm proponent of this. I think we should pay people to be in clinical trials. Some of my colleagues at the University of Pennsylvania have published really important guidelines on this, differentiating reimbursement, making it cost neutral for someone to be in a clinical trial, compensation, paying a fair wage for the time and energy it takes to participate in a clinical trial, versus incentivization, actually offering someone enough money to maybe even change their mind if they're on the fence, to give them enough amount of financial incentive to actually enroll in the study. And I'm a proponent for incentivization. I think the bare minimum we should achieve is cost neutrality. People should not pay to be in clinical trials, and I believe strongly no one should ever pay to participate in a clinical trial. But I think we have to go above and beyond that. And in studies like AHEAD 345, we do offer compensation to participants for each visit that it requires them to enroll to participate. But also, essentially all of our clinical trials require two people to participate, a participant and their study partner. And in prevention trials, the burden on the study partner is minimized to the greatest extent possible, basically having a visit per year that often is done by phone. But we're paying the study partners in AHEAD 345 as well, because we recognize that the contribution made by people participating in these studies is as important as the contribution made by anyone on the investigative team. And in fact, one of my favorite sayings is that when you participate in a clinical trial, you're no longer a patient, you're the most important member of the research team. And I believe that wholeheartedly. So a couple of other questions. I'm getting some questions about Alzheimer's disease and brain health. Is Alzheimer's disease hereditary? We do know that people who have a family history of Alzheimer's disease are at increased risk to develop it themselves. This is certainly not the whole story. This is not a strictly inherited disease. If you had a parent with this disease, it doesn't mean that you will get it. Just like if both of your parents lived to be 95 with normal memories when they passed away, it doesn't mean that you are certainly safe from getting Alzheimer's disease. It is a very complex milieu of events that leads to the occurrence of Alzheimer's disease. And we know that this includes genetic and hereditary pieces, but how we treat our brains and how we treat our bodies throughout life. And indeed, many studies now show that midlife risk factors are really important into who does and does not get Alzheimer's disease. So obesity, cardiovascular disease, smoking, high blood pressure, high cholesterol, all of these things are risk factors for getting Alzheimer's disease, and we should all do everything we can to try to lower those risks. So if you're a smoker, please stop. If you have challenges with your weight, if you meet the criteria for obesity, you should work closely with your doctor to put together a diet and exercise plan. That diet and exercise plan could be multiplying in its benefit because exercise and certain foods in our diets like fish and dark green leafy vegetables and fruits that are high in antioxidants all can actually lower our risk. Another question about whether there are genetic tests that a person can get. There are, in fact, genetic tests that are offered through direct-to-consumer genetic testing companies that include a genetic test for one of the genetic risk factors for Alzheimer's disease, a gene that we call ApoE. We've written about this in the literature and feel pretty strongly about it. I'm not paternalistic about it. I think that some people really want to know their genetic risk, and that's okay. But one thing I really urge people to do is to get genetic counseling before they have that test. Once the genie's out of the bottle, you can't put it back in. The toothpaste in the tube analogy also works. And unfortunately, a lot of people undergo these genetic tests without really educating themselves or working with professionals to fully understand the meaning of the genetic tests, the implications of the results. And too often we see people who seek out that information after learning the genetic results. And at least some people with education and counseling will actually change their mind about whether they want this information. So sadly, with the direct-to-consumer companies, not enough people are taking advantage of the genetic counseling opportunities that exist, and I really strongly urge people to do that before they have these genetic tests. Let's see, other questions. Is it useful for me to sign up even if I don't have Alzheimer's disease? Yes, absolutely. This is going to take a real change in our sort of public approach to research participation if we're going to succeed. And I participated in a NIH meeting a couple years ago called Inclusion Across the Lifespan, excuse me. And I am going to borrow a phrase from that meeting that I really, really appreciate. They said we need to change from a culture of protecting from research to a culture of protection through research. And I think until we as a society view research participation as part of everyone's role to support our efforts to advance medicine and improve the way we take care of people and try to prevent disease, we're going to face these long, slow uphill battles to test new medications and to test new ideas in diagnostic. We really want to move as fast as possible, and in Alzheimer's disease, we really have no time to waste. There are more than 5 million Americans dealing with this disease, tens of millions of people worldwide, and still the fastest growing segment of our population is older people who are at increased risk to develop Alzheimer's disease. So if we don't figure this out soon, it's gonna produce a public health burden that we really cannot sustain. I know it sounds strange to say that while we're enduring a global pandemic that is producing a public health burden that we can't sustain, but this is hopefully in COVID-19 something that we will get through in the coming months, and there's a lot of research ongoing to help us do that. We should all act accordingly by practicing social distancing and wearing masks to slow and stop the spread of COVID while researchers are doing their work to figure it out and find preventions pharmacologically. But once we're through that, Alzheimer's disease is something we're going to be dealing with for the coming decades. And I'm deeply privileged and honored to be a part of a national and truly a global effort to try to do something about that health crisis. So I have about 2 minutes left in my time with you live on Instagram. And I wanna use it to say thank you for joining today. Thanks to my colleagues and partners at the Women's Alzheimer's Movement for the incredible job they are doing of getting the word out about Alzheimer's disease, the importance of early diagnosis, and the importance of supporting research. And I end just about every public talk I give by telling my audience how they can help research. You can do what I call the 3 H's. You can advocate, you can donate, and you can participate. So please advocate for WHAM and other groups. Please advocate for caregivers who are in the throes of loved ones and their families who are dealing with this disease. Please donate to WHAM, support their efforts, and please participate. Think about signing up for APT web study or a registry at your local Alzheimer's Disease Research Center, which you can find through the NIA website, and think about whether participating in a clinical trial of a lifestyle intervention or even of a drug that we hope will be able to someday prevent people from ever getting Alzheimer's disease. Stay safe. Thanks for joining me today, and I hope to see you again in the future.